I have just had the privilege of meeting Hannah Kaleona.
Kalua, yeah, right.
Kalua.
Kalua.
Hannah, tell us, come stand here and then I'll get your presentation up. Tell us a little bit about what you do.
Okay, good afternoon. My name is Hanna Kaleova, and I work at the Institute for Clinical and Experimental Medicine here in Prague. It's one of the biggest hospitals in the Czech Republic, and I work at the Diabetes Center. We treat people with diabetes. We have a special transplant program for those who have type 1 diabetes. Also, a lot of research is going on in this area. Then a big diabetic foot group with people that have diabetic feet, you know, the ulcers and poor blood supply in their legs. So that's another area of research. And my area of research is I am a part of the metabolic group, which specializes in investigating the mechanisms of insulin resistance and beta cell failure. And I specialize in dietary interventions in type 2 diabetes.
Tell us a little bit about your background educationally.
Well, I graduated at the Charles University in Prague. And in fact, I started at the Institute for Clinical and Experimental Medicine afterwards. So right after school, I started at the Diabetes Center.
Okay.
My first study that I conducted at the center was a study with the vegetarian diet compared to conventional diabetic diet in patients with type 2 diabetes. And I will let you know some of the results. And then the second, even more exciting study was with the frequency of meals. It has been recommended to eat small meals during the day, like 5 or 6 small meals during the day for patients with type 2 diabetes. And we compared breakfast and lunch, only 2 meals a day, with 6 meals a day. And I will also show you our results of this study.
Wonderful. Now, in the country I come from, people who specialize in nutrition and get licensed are called dietitians. Are you, obviously your background is in nutrition.
I'm a medical doctor.
You're a medical doctor. See, I have to apologize.
Yeah, it's okay.
No one clued me into that. But you have a key interest in obviously in nutrition. Right. Okay, very good. I really appreciate your coming. And this is the first time I had a chance to meet Hannah, and she just arrived, or I just arrived before we started class here. But we're delighted that you've taken time from your, no doubt, very busy schedule to be here. Now, I understand you presented a paper recently in Chicago, is that right?
That is upcoming
that's
in June. Yeah,
you're coming.
At the American Diabetes Association Congress.
Okay.
For 20,000 people. I'm a little bit scared.
You'll do fine, I'm sure.
Yeah.
Now, what is that paper on?
It's on the frequency of meals, and
you're going to talk about that to us now.
Yeah, you will see the results also.
Wonderful. Wonderful. Well, we're glad that you can be here. Let's all give Hannah a hand. I don't have a remote.
That's okay.
So you can just use these keys or the N for the next. Okay?
Okay, thank you. So I called my presentation Dietary Treatment of Type 2 Diabetes. Current recommendations underline the importance of caloric restrictions in patients with type 2 diabetes, then the importance of cutting down on carbohydrates, especially simple carbohydrates, and the decrease of intake of cholesterol, saturated and trans fatty acids. The outline of my lecture today will be first the content of the diet. I will compare the low-carb diets namely the Atkins diet and the Mediterranean diet, with high carb diets, especially the vegetarian diet. And then we will look on the frequency of meals in patients with type 2 diabetes. What is the cause for low-carb diets? Mainly, it's the finding that the growing epidemic of overweight and obesity is corresponding with increased intake in simple carbohydrates, especially fructose, high fructose corn syrup, and sweetened beverages. So the aim of the low-carb diets is to decrease the intake of carbohydrates, especially simple carbohydrates. But in fact, if you look at the development of food consumption in the last decades, we can see that the consumption of most food items increased, and so the total energy intake increased. Also, the intake of carbohydrates increased, and also the intake of fats increased. But the percentage of fats decreased. Let's look at the Atkins diet in treatment of obesity and type 2 diabetes. Why is Atkins diet so popular? Why do people try to lose weight using Atkins diet? You can see all the unhealthful foods you can imagine, stuffed with saturated fat and cholesterol, like processed meat, sausages, eggs, fatty cheese. And yet people choose this diet to lose weight and even try to cure diabetes by this diet. So we will look at why do people lose weight. We will try to find some positives of the Atkins diet and the unfavorable effects. So why do people lose weight? First, it's of course the decrease of intake in simple carbohydrates, but also a decrease of intake in fats, because if you cut down and stop eating bread, of course you decrease also your consumption in processed meat and cheese and the things that you eat with your bread. If you stop eating pasta, you also stop eating the gravies with the pasta. And also if you stop eating the sweets because of the sugar contained, you also stop eating fats contained in the sweets. Are there any positives about Atkins diet? Of course, it's a palatable diet. The people don't need to change their dietary habits much. There are some studies showing that it may lead to a decrease of triglycerides and increase in HDL cholesterol. However, the Atkins diet has also some adverse effects. First, it's the increase, according to some studies, increase in triglycerides, decrease in HDL cholesterol, and increase in homocysteine. And definitely, it's an increase in LDL cholesterol. And studies show that this diet leads to a progression of atherosclerosis, which is quite fast. It's about by 40% within 1 year, which is a lot. So it may lead to some weight loss. However, I would not recommend this diet to any healthful person or patient with type 2 diabetes. Let's look at another diet that is quite low in carbohydrates, which is a Mediterranean diet, which contains about 30 to 40% of fats, and which is really high in monounsaturated fats that are healthful. It is rich in vegetables, pulses, grains, fish and fruit. So it's very close to a vegetarian diet, however, it is not vegetarian. We will look at the positive effects of the Mediterranean diet, and we will compare the Mediterranean diet with a high carbohydrate diet with a low glycemic index, very close to a vegetarian diet. So first, the positive effects of a Mediterranean diet is palatability. The high content of fat and olive oil and nuts makes the diet really palatable, which affords the long-term compliance of the people with this diet. And also the Mediterranean diet leads to a lower cardiovascular and total mortality by about 9%. The olive oil and nuts have anti-atherogenic and anti-thrombotic effects. The investigators tried to score the dietary habits of the people in different countries and give them points for the habits according to Mediterranean diet, and they found out that really if you have a high score in the Mediterranean diet habits, then you are more prone to lose weight during the time, but there are many differences between the countries. Let's compare this Mediterranean diet with a high carbohydrate diet with a low glycemic index, very close to a vegetarian diet. If we take body weight, glycemic control, and blood lipids, then in all these three parameters, the high carbohydrate diet tends to be better than the Mediterranean diet. It has been shown that even the postprandial plasma glucose and plasma insulin concentrations and the glycemic variability tend to be lower after the high carbohydrate diet compared to the Mediterranean diet. Also, the blood lipids, the postprandial blood lipids that are the major risk factor for cardiovascular mortality tend to be lower in response to a high carbohydrate diet. And now we move on to the other part of the spectrum, to the high carbohydrate diet, and especially the vegetarian diet. We will look at the positive effects, but also at the stumbling blocks of vegetarian diet. What are the positive effects of a vegetarian diet? First, vegetarians live longer than non-vegetarians. The difference is about 3.5 years if we adjust for other confounding factors. If we don't, then the difference in the lifespan can be even 10 years. And it's mainly because of the lower cardiovascular mortality compared to non-vegetarians by about 25%. Lower risk of cardiovascular disease is due to decreased total and LDL cholesterol, lower blood pressure, lower body mass index, and lower incidence of type 2 diabetes. And the vegetarian diet is the only diet that has been shown to lead to a regression of atherosclerosis compared to progression with the conventional diet and with Atkins diet. Vegetarian diet leads also to a decreased risk of cancer, of all malignant tumors, especially to lower incidence of colorectal, prostate, and breast cancer. Now, if we compare vegetarian to conventional diet in patients with type 2 diabetes, we can see that vegetarian diet leads to a greater weight loss and reduction in fasting plasma glucose, and also to a greater reduction in LDL cholesterol, HbA1c, which is the main parameter for glycemic control in patients with type 2 diabetes, and a greater reduction in medication. We conducted a study that took 6 months, and we randomized the patients into a vegetarian and control group. And we also found out that vegetarian diet leads to a greater weight loss, which is mainly due to greater reduction in visceral fat. We also showed that the vegetarian diet leads to a greater increase in insulin sensitivity, one of the main pathogenic mechanisms of type 2 diabetes, and a greater reduction in diabetes medication in 43% of the vegetarian participants, compared to 5% in the control group. What surprised us was the big difference in oxidative stress markers. Of course, vegetarians had higher levels of vitamin C, but what surprised us was the big difference between the groups. And the vegetarians had higher blood levels of enzymatic oxidative stress markers that are protective, like superoxidismutase and reduced glutathione. On the other hand, there are also some stumbling blocks with vegetarian diet. Of course, if you become a vegetarian, you have to learn new habits, new recipes, learn a lot new things. There are people that just drop out meat and they are so-called junk food vegetarians, eat only at the fast food restaurants, which is also a stumbling block of the vegetarian diet. And another stumbling block is extremism. If you have an extreme diet, not balanced, then you are prone to have some vitamin deficiencies. But even though there are these stumbling blocks, they can be overcome. And the official proclamation of the American Dietary Association and Canadian Dietary Association and World Health Organization is that appropriately planned vegetarian diet, including total vegan diets, are healthful, nutritionally adequate, and may provide health benefits in the prevention and treatment of certain diseases. I would add even diabetes, type 2 diabetes. Well-planned vegetarian diets are appropriate for individuals during all stages of life cycle, including those that are pregnant, including those that lactate, for children, and even for athletes. Also, a vegetarian diet can meet all recommendations for all nutrients, including those more difficult ones. However, the variability of dietary practices among vegetarians makes individual assessment of dietary adequacy essential. And in addition to assessing dietary adequacy, food and nutrition professionals can also play key roles in educating vegetarians about sources of specific nutrients and food purchase and preparation and dietary modifications to meet their needs. So in conclusion of the content of the diet, vegetarian diet can be recommended for patients with type 2 diabetes after individual assessment of dietary adequacy by the physician and or a nutrition professional. And now we move on to the question of frequency of meals in patients with type 2 diabetes. It has been recommended for patients with type 2 diabetes to eat 5 to 6 small meals during the day. However, when we searched the literature, it really dawned on us that it has been shown that intermittent fasting has positive effects on glucose metabolism and cardiovascular disease in experimental animals. In fact, in experimental animals, the most frequently used protocol, the every other day fasting, when the animals are fed every other day, leads to a prolonged span of life, improved glucose tolerance, decreased incidence of diabetes, and increased insulin sensitivity. Also, animals that are fed a high-fat diet, which leads to diabetes, it has been shown that there is a difference if you feed them ad libitum, if they just can eat whenever they want, or if they eat only in time-restricted manner. And it has been shown that those animals that are fed in time-restricted manner, even the unhealthful diet, they are relatively protected against obesity and type 2 diabetes. In humans, it has been shown, observational studies have shown that more than 3 meals a day lead to increased energy intake and to obesity. A randomized controlled study that included 50 people and lasted for 6 months showed that more smaller meals during the day don't mean a bigger weight loss than bigger meals do. Also, a distribution of the meals during the day is very important. It was shown that the evening meals leads to a greater fat deposition than the same meal consumed in the morning or in the early afternoon. People who usually eat breakfast usually have a lower body mass index than those who skip breakfast regularly, even though the absolute amount of calories per day may be bigger in those who eat breakfast regularly. An interesting study from this month showed that early eaters have bigger chances for weight loss than so-called late eaters who ate their lunch after 3 p.m. It was a big study. There were 420 people, and it lasted 12 weeks. When we searched this literature, we just wanted to make our own study. And the aim of our study was to compare the effects of 6 meals with only 2 meals, breakfast and lunch, with the same caloric restrictions, minus 500 kilocalories per day in patients with type 2 diabetes on body weight, glycemic control, insulin resistance, blood lipids, and resting energy expenditure. The diet was very much plant-based with a lot of fiber, 30 to 40 grams of fiber per day. And the regimen of 2 meals consisted of breakfast eaten between 6 and 10, and of lunch eaten between 12 and 4 p.m. The regimen of 6 meals a day consisted of 3 main meals, breakfast, lunch, and dinner, and smaller snacks and second dinner in between. We used the design of a randomized crossover study, and 54 patients with type 2 diabetes treated by oral hypoglycemic agents were randomized. We used indirect calorimetry to individualize the diet according to the measured resting energy expenditure. And the patients were randomized to either to start with 6 meals a day for 12 weeks or 2 meals a day for 12 weeks, and then they switched. We measured the weight, the basic laboratory parameters, and we also measured the insulin sensitivity by a hyperinsulinemic isoglycemic clamp lasting 3 hours. When a patient lies down in a bed in our lab, and we use 2 infusions, infusion of insulin and glucose. Insulin goes by a constant rate, and what you adjust is the infusion of glucose. The more glucose you use for the patient, the more insulin sensitive the patient is. Our patients, the mean age of our patients was 59 years. They were about half and half men and women. The mean diabetes duration was 8 years, and the mean weight was 94 kilograms. You can see that one half of the patients started with 6 meals a day, the other half with 2 meals a day, and after 12 weeks they switched, and 87% of the participants completed the whole study. To maximize the compliance of the patients with both regimens, we started each regimen with a 4-day tutorial where the patients learned in detail how to compose the diet and how to prepare the meals. We also conducted group meetings and individual counselings throughout the study, and all the meals were provided for half of the participants. We afterwards evaluated the 3-day food diaries at the beginning and after each regimen. And now to the results. The results are shown as the difference from start and a direct comparison between 6 meals a day, where you can see A6. A6 is for 6 meals a day, compared to B2, which is 2 meals a day. You can see that body weight decreased in both regimens, but it decreased more with 2 meals a day. Also, fasting plasma glucose and fasting C-peptide decreased in both regimens, but they decreased more in the regimen of 2 meals a day. Insulin sensitivity increased and HbA1c decreased in both regimens comparably, with no difference between the regimens. Blood lipids, triglycerides, and LDL cholesterol decreased comparably in both regimens, and neither total nor HDL cholesterol changed significantly in either regimen. Resting energy expenditure decreased in both regimens, and there was a trend toward a smaller decrease in resting energy expenditure with 2 meals a day, suggesting that the patients were more prone to lose weight with the regimen of 2 meals a day. To summarize the results, 2 meals a day resulted in a greater weight loss, greater reduction in fasting plasma glucose and C-peptide, and a comparable increase in insulin sensitivity and a comparable decrease in HbA1c and blood lipids, and a trend toward a smaller decrease in resting energy expenditure. To conclude, our data suggests that a larger breakfast and lunch may be better for patients with type 2 diabetes than 6 smaller meals during the day. When the world's oldest man died at 114 years, Walter Bräuning attributed his longevity to also eating just 2 meals a day, which brings us back to the old proverb, eat breakfast like a king, lunch like a prince, and dinner like a pauper. Thank you for your attention.